the same time. So we need to be very, very cognizant of the fact that we need to keep reducing the chance for this virus to spread. We need to reduce our risk of being exposed and the risk that we expose others. I'd love to be sitting here telling you that we're going to solve this with vaccines right now, but we're not. Unfortunately, vaccines are distributed in a very, very unequal way around the world. And while we need to get more vaccines to all countries really quickly, right for now, this is not going to solve the immediate problem. We have to stick to reducing exposure, reducing our chance of being infected, and reducing our chances of infecting others. And that means that individual public health and social measures and community measures will still need to be the centerpiece of what we do in the coming weeks and months, while we work as hard as we can to increase vaccination rates around the world. Maria?
Thanks, Mike, and thanks, Alex, for having us back again. I mean, Mike's covered a lot of this. It's just, you know, at a global level, 5.5 million cases reported in the last week. It was 5.7 the week before and 5.7 the week before that. We shouldn't be in this position 17 months into a pandemic when we know how to prevent infections, we know how to prevent spread, and we know how to save lives. Your specific question, you know, around what we're seeing globally, again, I refer all of the viewers to look at our weekly epidemiologic update. The detail that we have in there by region, you know, really shows that the intensity of spread is not the same around the world. As Mike pointed out, we are seeing a slight decrease in case numbers, but I'm looking at this right now as I'm speaking with you. The variability around the world is really quite striking. We have hotspots, countries that are under extreme pressure in all regions. They're at different levels of intensity, but in all regions. So we're not out of the woods. This is not over. I know some countries that are fortunate enough to have vaccines, and a lot of vaccines reaching large proportions of their population should be grateful and are grateful for that. But the world does not have access to this vaccine. And so, as Mike pointed out, this uneven and inequitable distribution of vaccines is really delaying the end of this pandemic. At the same time, we have these proven public health measures. It's the physical distancing, it's the hand hygiene, it's the wearing of the mask, it's the good ventilation, spending more time outdoors than indoors, staying home if you're unwell, staying home if you're asked to. And it's about a public health infrastructure. What we still need around the world, even countries that are showing us that COVID can be controlled with these proven public health measures, we need countries to continue to build capacities for surveillance, for testing, using the latest tests that are approved, having public health action associated with that test, isolating cases, especially, you know, so that they don't provide an opportunity to spread the virus, providing supported quarantine for those who are contacts of cases. It's all of that above, and we really need to be able to do that. So you may hear a frustration in our voice, but it's a frustration because we all know there are measures that we can take to keep people safe. It is very difficult to do 17 months in. We understand that completely, but we need cohesive, coherent plans by governments across regions and across the world to end this pandemic. Vaccines are part of the solution, but they are not the only tool that we have in our toolkit.
Thank you, Mike, and thank you, Maria. There's still ongoing concern among the public about the virus variants circulating around the world, and especially about those that have been identified in India. So, Maria, can you maybe tell us what is the latest knowledge about variants of concern that we have, and in particular to those identified in India?
Yes, thanks, Alex. So we continue to track this virus around the world through case detection, you know, who is infected with the virus. This is first and foremost the most important thing that we can do. So if we know where the virus is, we know what measures we need to take to care for those who are infected and reduce the spread. SARS-CoV-2 virus, the virus that causes COVID-19, changes over time. There are mutations that have been identified since the beginning of this pandemic, and we are tracking these virus variants around the world. On Monday, we reported that an additional virus variant called the B1617, it's a lineage that was first identified in India, is classified, is characterized as a variant of concern. And this is because we have some evidence of increased transmissibility. The details about what we know and from the studies that are available are outlined in our site, in our a weekly epidemiologic report. There's a lot of detail in there. There are studies that are looking at transmissibility, they're looking at severity, and they're looking at the impact of diagnostics, therapeutics, and vaccines. This virus variant of concern, the B617, has 3 sublineages. I don't want to go into too much technical detail, but it's important because we don't yet have enough information to characterize at the sublineage level, which is why we're saying that B1617 is a variant of concern. Now, Alex, you'll notice I did not say country X variant. This is really important because we don't want to stigmatize those countries that are carrying out surveillance, that are doing genetic sequencing, that are doing the studies, that are sharing this information and reporting around the world. We need more sequencing to be done, targeted sequencing, sharing of information, sharing of epidemiologic and clinical data with those sequences, so that we as WHO, with our partners around the world, our virus evolution working group, can work towards characterizing them, understanding them. What are the importance? And so we don't want to add any further stigma for any of these variants that are being detected. So right now we have 4 variants of concern we're tracking. The B117, first identified in the UK, the B1351, first identified in South Africa, the P1, which was first identified in Japan, but is circulating in Brazil and other countries, and now this B1617. We will continue to track them and monitor them. The information we have so far is that the public health and social measures continue to work. So that means that no matter what virus is circulating, the public health and social measures still work at reducing the spread. Our diagnostics still work, so we can still detect cases with virus variants or not. And we can, the therapeutics and the vaccines still work. There are many more studies that are underway, and if anything changes related to that, we will inform you, our member states, ministries, as quickly as possible. But it's an important message in there. If you are offered the vaccine, if it is your turn, get vaccinated, but also continue to do all of the measures that we just outlined before to keep yourself safe. So it's a moving picture, Alex. It's a lot of information. I know that's a really long answer, but we're grateful for countries that are doing the surveillance, that are detecting, that are working with us to characterize these. Watch this space, I would say. But do look, if you are of a more technical background watching this, look at our sit reps. They're published every Tuesday evening. And the detail that's in there on the 4 variants of concern, as well as 6 variants of interest that we're tracking, is in there. And if there's anything not clear, Alex, just let me know.
Thank you, Maria. And here are a few follow-up questions from viewers as you were speaking. First is from Abid Jamal Patan. Why COVID is spreading more in India in comparison to other countries?
Well, it's a good question. Mike, do you want to take that one?
It's a good question, and it's probably the same question that was asked in Europe during the Christmas holidays and South America, and every area that's experienced a big surge has always looked to say, well, how did this happen? How did we get where we are? And in all cases, there are many things driving that. Certainly, the coming together of many, many people in mass gatherings, religious ceremonies, weddings, and that mixing again of the population was a major driver in many countries, and I believe in India as well. And that really has been a big factor in driving transmission. And then we can add to that the fact that we've had B117 and B1617 in the country as well. And we've seen in Europe that the B117 variant did add energy and added momentum to the virus within the community. But if the community are able to do all the things that need to be done, none of the variants are really well able to transmit. They're better able to transmit in situations where we're doing the kind of mixing and the kind of, in some senses, not implementing all of those measures that Maria outlined earlier. And I think that has been probably the major driver of the situation in India. And I know how tough it is to sustain this. I mean, communities in South Asia and Southeast Asia, all over the world, have been sustaining activities for over a year now. It is very, very tough to do that. But I think what we've seen again and again in the Americas, in Europe, now in Southeast Asia, is that when we let down our guard, the virus takes advantage. Maria said it a few times in the past. We may think we're done with the virus, but the virus ain't done with us. And that's the unfortunate reality. And we do not have vaccine distributed around the world in enough volume to the right people in order to reduce the death rates and hospitalization rates that become associated with increased transmission. Increased transmission, unfortunately, for most countries, leads to many more sick people, many more hospitalizations, and many more deaths. Some countries are breaking that cycle now because they're getting access to vaccines and they're able to vaccinate their most vulnerable. They're able to vaccinate their health workers. And in that sense, they're shutting down the tragic part of this pandemic. That's why WHO, working with COVAX partners, wanted to get 20% of people in all countries vaccinated so we could protect the most vulnerable. We could protect our frontline health workers. We could take the death and the tragedy out of this pandemic. The fact that we have many, many countries in developing countries who have hardly started vaccine at all due to the lack of vaccine availability means those countries are behind. And they're behind because of inequity in vaccine distribution. Even if we have that distribution at 20%, it's still difficult to stop transmission with vaccine alone. You will not simply do it with 20% coverage. We will have to reach much higher levels of vaccine coverage, combined with the social and physical measures that we've already been carrying out to significantly impact the epidemic curves and bring the number of cases down. And in a situation like India finds itself with a very large, very dense population, very difficult to reduce the force of infection and the number of cases daily unless we find ways to reduce the disease spreading between people, and that means reducing exposure. And it's simply, we have to try and achieve that, while at the same time accelerating as quickly as we can access to safe and effective vaccines. Maria?
Yeah, I mean, Mike, hard to add from you here. It's a combination of factors, as Mike said. I mean, everybody wants to really think that it's one thing alone that's really driving something, or it's one thing alone that's going to protect us. It's about a combination of factors. You know, the increase in transmission that we've seen in India, the trajectory of transmission, that really sharp increase we've seen in other countries as well. The intensity of spread and the population density in India is much greater than other countries. And so you can quickly overburden a system that is burdened already due to being 17 months into a pandemic. But this trajectory, this really sharp increase in transmission is driven by a number of factors. It's the increase in social mixing, as we've said. It's the number of contacts that you have. Just think about it. If you are staying at home and you limit the number of people that you come in contact with, and then something changes and you automatically, see people of 2 or 3 different households, and instead of seeing one person that day, you see 15 people that day or 4 people that day, whatever that is, you're increasing the number of people you come in contact with who could potentially be infected with the virus. So you have to make sure that you take all of the measures that you can. So if you are leaving your home, know what your risk is. What is your exposure throughout your day when you leave your home, if you go to work, if you're going to a social event, and what are the things that you can do to limit exposure and reduce the possibility of you getting infected, and if you are infected and you don't happen to know about it, to pass it to somebody else. So that increase in social mixing is really critical. And it's not just the big gatherings, it's also the small gatherings. A lot of transmission in some countries are driven by small gatherings in people's home. If you have people over for an event, a dinner party, or whatever it may be within that country, if you bring more people together and the virus is circulating, it will take advantage of that. And so there are things that you can do. The other factors are these variants that we've pointed out. Increased transmissibility means, and in fact, when we say increased transmissibility, some of these virus variants, the variants of concern, have mutations, for example, that allow the virus to enter the cell more easily. And so it can infect you more easily. It doesn't mean that the modes of transmission or the way that it spreads is different. It's more easier to actually infect someone else. The other thing is the relaxation of some of these public health and social measures. If it's done too quickly, if it's done in an uncontrolled way, in the sense that you do a little bit at a time, you wait to see how it's working, and then you do a little bit more. If it's done in an all or nothing, then it allows the virus to spread. And the vaccine, the inequitable and uneven distribution. So that combination of factors is dangerous. And we see this over and over and over again. And unfortunately, we're seeing it in India, but there are a lot of other countries around the world that are facing very similar situations. And we cannot take our foot off the gas. You've heard Mike say this acceleration. We cannot take our foot off this accelerator of doing everything that we can to limit the spread, because it is within our power, and we need governments to be able to support people to do so, to limit the spread. So we will continue to be broken records. Mike and I have been doing this for the last 17 months or so, right, Mike? We've been accused of being broken records, but we've been accused of worse. So we will continue to keep putting these messages out and making sure that we provide supported environment so that people can do what it takes to keep themselves safe. But it's no one measure alone. It's no one factor alone. It's all of the above. So let's do everything that we can to really keep ourselves safe.
Thank you both. And Maria, you were mentioning the different type of gatherings, and we've been seeing a lot of questions those days coming about how long can we interact with the person to stay safe from infection. So is there a time limit? And maybe then you can remind our viewers on those 3 factors that we should look into to minimize our risk.
It's a great question, Alex, because there's no set exact time. It really depends on the setting. It depends on the type of exposure that you have. It depends on the duration of contact that you have with an individual. So these combination of factors, this duration, the setting, the intensity of exposure. So for example, the longer you spend with someone, it's riskier to spend time with someone longer rather than shorter. Spending time indoors is riskier than spending time outdoors. If you're in a crowded setting, that is riskier than in a less crowded setting. So there's a number of factors that are there. And so all of these things need to be taken into consideration when you think how much is enough. We don't know the infectious dose, how much virus actually needs to pass from an infected individual to an uninfected individual to cause that infection. There's a lot of research that's underway to look at all of these different factors. But for everyone that is out there, what you need to know is about, the longer you spend with someone, the closer the distance you are. Indoors is riskier than outdoors. If you can look at each of those factors, so the distance from someone reduces your risk. Spending more time outdoors than indoors reduces your risk. Making sure that your duration is the shortest amount of time possible rather than spending long periods of time. And what interventions you have in place, the mask, the hand hygiene, the good ventilation. And in many situations, it's as simple as opening up a window if it is safe to do so. So again, it's a long answer because it isn't just one factor. It isn't just one simple thing. It's all of these different factors that can increase your risk. But if we take measures, we can actually reduce our risk.
Thank you, Maria. And here is the question coming from a LinkedIn viewer. What is your advice and suggestion for the people of India to get through this situation?
First of all, our sympathies to all in India and in other countries suffering in this, and especially to the families of people affected by COVID who've been trying so desperately hard to help and assist their own families and others in their community. We're doing, and many international partners, the UN system, other governments are doing their best to provide whatever assistance possible to the government of India in order to support the health system, primarily to deliver healthcare to people who are deliver treatment and help to people who are very sick right now. The number of cases in India has stabilized and dropped off a little, But they would be very, very silly to assume that that's the end of it. It's not. India is still in a very difficult situation. I believe the government have mobilized a huge number of resources to try and address this, from oxygen supplies to treatment facilities, and so much going on. But India is a very diverse country, a huge country, and one in which the situation in different states is extremely different, and the response in different states is therefore different. I think for people, and I know the Indian diaspora and people abroad and our own staff here have been greatly concerned and trying their best as individuals to provide what support they can to their families, their communities back in India. So first of all, there's a huge amount of solidarity out there for communities in India and elsewhere who are suffering. And everyone on the international side is trying their best to do what they can to support the Indian government and the Indian people. The Indian government and in India in general has been very good in the past at being able to contain infectious diseases, particularly polio. India did a superb job in being able to contain polio, but it did that with access to vaccine mainly, and access to good surveillance. So India will get through this. India is a great nation, great people. But India is suffering right now. And if everyone in India really wants to help the situation, I would just advise all Indians, just to the extent you can, please reduce your risk of being exposed to this virus. And please reduce your risk of potentially exposing someone else to this virus. And that means your physical distance, if you can, maintain it. It means washing your hands. It means wearing a mask. It means not going into crowded spaces and spending time there. It's about having, if you have to be inside, and many people have to be, is to ensure that you have windows open. Really, really important to have good ventilation in any indoor space. So all of those factors put together, I know that is not an option open to every Indian. I know this. But it is something everyone must try to do, because if we can take the heat out of the transmission, then the number of people arriving in hospital, the number of people needing that care will drop. The other thing I think that we need to do is ensure that the sickest people and the people most in need of care get the best care, and that there's a way of ensuring that those people get access to care is not based on their financial resources, but based on their actual condition. And that is difficult to do in any country, and in India the health system struggles at times to deliver that type of equity in healthcare to all its people. I know there's a huge attempts to try and do that, and the government is heavily engaged in trying to increase oxygen supply, increase clinical care, and all of that. And we will continue to do everything we can to support them. But for now, and we will do everything in our power as well to increase vaccine supplies. And we are advocating every single hour, every single day, to increase vaccine supplies to all countries, including India. And India has served the world in being able to produce vaccines, and has produced and given vaccines and sent vaccines to many countries before it's been hit by this wave. I think it's important to see that solidarity returned from other countries at this point. So it's a difficult situation, but India, as I said, Indian people are smart. And if Indian people can implement those basic measures to the extent that they can, I believe the intensity of the transmission can drop. And once that intensity of transmission drops, the health system can recover enough to treat all of the patients that it needs to treat. The problem at the moment is the system is just overwhelmed, and it's unable to deliver an adequate level of healthcare to all who need it. Maria?
Yeah, no, I would just, add my sympathy as well, and endorse everything Mike has said in terms of what we're trying to do and what the Indian people are trying to do. I would echo this for every other country around the world. Right now we have a lot of attention, rightly so, on India and what India needs to get through this. And we as WHO, through our regional office and our country office and all of the staff that are deployed, are doing what we can to help. But the situation, as I mentioned earlier, in other countries is also difficult. I could name a dozen countries right now where we're seeing something that could potentially be very close to what India is seeing. So everyone, if the virus is circulating, any SARS-CoV-2 virus, variant of interest, variants of concern, from a general public point of view, it doesn't matter which one, because all of these viruses can infect you. And if the virus is circulating, it will spread. So everything that Mike just outlined, do what you can. If you are able to work from home, if you are supported to be able to do that, do so. If you can reduce your contacts, reduce your contacts. If you could postpone that social gathering or that travel that's not essential, postpone it for now. We will get through this. I think, one of the difficult things I find most in communicating this is, how long, how much longer. But for some of these activities, it's just not time yet to resume. And so what you can do in your country, if this virus is circulating, do everything that you can right now, everything that you can to keep yourself and your loved ones safe. And there is a lot that you can do within your power. We are asking governments and we are providing support to governments to be able to enable populations to carry out these measures at home, in workplaces, in schools, public transportation, because we know people need to live. People need to leave their home to make money to feed their families. We have essential workers, our frontline workers who are caring for patients. We have essential workers who keep electricity on, who farm, who provide food. All of this needs to continue. So if you just ask yourself, what can I do? Even in countries that have, access to the vaccine, there are things that you can do too. You can also do what you can take. You do what you can to keep yourself safe. And if you want to make a donation to the Go Give One campaign, to the WHO Foundation, to whichever foundation you see fit that can help get vaccines to those who need them most or who could provide some local support. We can all take action. It's not just a matter, we shouldn't just say, what can I do? We need to take action to do that. And just lastly, quickly, is just look out for your mental health, look out for your well-being. This is incredibly difficult. And I don't know about you, but I find every day this gets more and more challenging. There is that light at that end of the tunnel, and it's a long tunnel, and it's a dangerous one, and many people aren't quite in it and don't quite see that light, and others are blinded by the end of that light, Tom Frieden said recently. But, we have to look out for ourselves, give ourselves a break, support each other, be kind, please, if you can, and do what you can to support. Pick up the phone, deliver a care package safely, stay outside. If it's safe to do so, just do what you can. We're in this together, no matter what. Until this is over, whether we like it or not, we are in this together, and we will get through this together.
Thank you, Maria, and thank you, Mike. And here's a question from Jess with Vincent asking for some of your advice about home care, how to help family members who are sick with COVID, but they are in home care. How to provide them with the good care at home.
Okay, yeah, I think Maria might give more details on our home care packages and how they've been updated. I think we need to separate here the ideas of home care, which is, providing basic care for someone who may have COVID, who's maybe not so unwell, but just needs good care. And it's the same with any infection, especially any virus infection, and especially any virus infection affecting you in the chest. First of all, it's the same advice. You can manage temperatures by using antipyretics or drugs that help bring down a temperature. It's about making someone comfortable, showing someone can drink and eat enough to keep up their levels of energy. It's about ensuring, obviously, someone in a home care setting who has COVID-19 is less likely to infect others. So you have to manage the risks in the home if someone is at home, to make sure that the problem doesn't grow and affect everyone else in the family. And then you have to, especially beyond that, basic care for the person, care for the transmission risk. And then you need, and this is, I suppose, the most important element of this, is watching out and watching that person for any significant deterioration in their condition. Most people will get COVID, they may be quite sick, but they progress and gradually get better. Some people will progress and then at some point will have a crisis. They'll have, usually involves some form of swelling in their lungs, where they stop transferring oxygen into their blood efficiently, and the level of oxygen in their blood drops, and it can drop precipitously. That is the moment where someone needs to be taken from the home and brought to a healthcare facility. And this is, I think, our essential problem, is that in some countries that healthcare is not available, and now someone is still in the home environment, sick enough to be in hospital, but not without access to that. And that's a very, very, very difficult situation for any individual or family caring for that individual, because there are no treatments for this disease that can be given safely in a home environment. There are some, and we've seen the use of inhaled steroids and others, if they're prescribed by a doctor in the situation, can help. But we don't have a way of providing direct clinical care in the home. Some countries will have outreach services and will have nurses and community health workers that can visit sick people, and that's very, very good, and that outreach. But that's generally outreach for people who are mildly unwell. Very unwell people should be in a healthcare facility, being treated by professional doctors and nurses, getting access to oxygen, getting access to dexamethasone or other drugs, and getting access to supportive care. And that's the tragedy in this world, is that there are many countries in which that is not guaranteed. There are many countries in which access to healthcare, universal access to healthcare, is not a guarantee. Certainly a guarantee without causing immense financial hardship for a family. Sometimes the kind of financial hardship that can break a family's prosperity for years. So families around the world face hugely difficult choices, and sometimes choose to care for someone at home because of the costs and the trade-offs of seeking healthcare, which in itself is a terrible tragedy. So home care is possible, home care for mildly unwell people, watching out for their status so that if it changes, they can access professional healthcare, and ensuring that someone gets into that healthcare as quickly as they possibly can, through the primary healthcare system and into the emergency medical system. But Maria, you may have more information. I believe we've updated our home care packages very recently, so you may have more information on what's out there.
Yeah, we have. I mean, we do have some home care bundles. We call them home care bundles, which is basically putting together the elements that health workers need to care for somebody at home. Providing individual level advice is very difficult because it depends on a lot of different factors. The person who is infected, their underlying conditions, the severity, a lot of different factors. And so we're working, as WHO, we work with ministries of health to advise at the most local level possible. We advise on the science look out for that Mike pointed out, and when to seek care. You also have to take into account other viruses and pathogens that are circulating around. If you're in an area where there's malaria, if you're in an area where there's dengue, if you're in an area with other infectious diseases that are circulating, that needs to be taken into consideration. So as an organization, as WHO, we work with our partners, we work with ministries of health to provide tailored, agile advice. But we do have a couple of health home care bundles that have been released recently, which basically takes our long guidance and it condenses them into some key things that need to be done, and translating them in many, many different languages so that they are accessible to people. But, as Mike pointed out, we can advise to do something to check the oxygen levels, but there needs to be oxygen saturation materials to be able to do so. Antipyretics, if there's fever. So it's a work in progress of getting this out there, making sure that it's the right information to those who need it most, and making sure that appropriate care is given in healthcare facilities, and in supporting the ministries and getting those health facilities ready. So we do have a whole separate area of work that we've done with our clinical teams, with our Khlainai network, with our emergency medical teams, with WHOni, to be able to build capacities or provide capacities that could increase the number of beds that are in countries to care for people who are mild outside of the home, but also to care for those who are severe. We've advised on the building of facilities, new facilities, severe acute respiratory illness facilities, with the proper spacing, with the proper equipment, with the proper ventilation, how to revamp existing buildings, refit them, to be fit for purpose for either mild patients or severe patients. So there are a lot of activities that are underway in which we have been supporting countries. This surge that we are seeing in India, we've seen in other countries. We are advising governments to prepare and to surge capacities now. We've actually been saying this for many months in the sense of you have to be at the ready. There is no peacetime anymore. Preparedness and readiness is a constant state that we need to be in, particularly for COVID-19, but for any infectious threat that threatens us. There isn't this peacetime of when we have a chance to catch our breath. Some countries have shown us that you can control COVID, but even countries that have controlled COVID, we would advise to build capacities, continue to build those capacities for public health, for community health workers, for contact tracers, for people who can run testing, who that needs to be done no matter what. And that will be an investment that can be used now for COVID-19, but it is an investment that will be good for any infectious threat, because unfortunately, we will continue to be threatened by infectious pathogens. So let's get through this one, and let's work together to get through this one, providing the best information we can, the supportive environment to prevent infections first, provide the clinical care to those who need them as best we can.
Thank you, Maria, and thank you, Mike. And we were talking about home care, but as Mike mentioned, there are patients who need professional care, and health workers, in particular nurses, because today is International Nurses Day. I would like to express our huge thanks for all they've been doing in the past 17 months to treat patients and to save lives. And maybe I would take this as a last question today from Mehnil Zehra, who is a nurse from Pakistan, and asking for your advice and tips how health workers can cope with COVID crisis.
That's a good question. I think the questioner was from Pakistan.
Yes.
Okay, well, Eid Mubarak to all of you in Pakistan. I spent a number of years working in Pakistan on polio eradication, so my regards to all my friends in Pakistan, as well as in India from my previous intervention. It's a really good question, and health workers can protect themselves against this part. And what's I think really important is the proper training and proper protective equipment, even in situations of high exposure and intensive care, is very, very effective at reducing the chance of infection in health workers. It is the same basic behaviors that health workers have to carry out, and then we add in layers of protective equipment depending on the risks that they are potentially exposed to. I think the difficulty we have is the level of training and awareness of health workers in different situations. We saw that with long-term care facilities where the levels of training and equipment were not good enough in many situations, and I don't mean in the developing world, I mean all over the world. Even in some of the most sophisticated technological countries in the world, the wealthiest countries in the world, struggled to contain infection in long-term care facility and struggled to prevent infections in health workers, both in long-term community care and in hospital settings. But we've learned more about how to do that. Health workers are getting more and more training. We've had a huge number of online courses that we've developed for health workers. We've got all kinds of virtual reality training for health workers on how to put on and take off protective equipment. But if you are to protect yourself as a health worker, number one, it's the environment you're in. If the environment you're in is full of patients and patients are too close together and you're overwhelmed and you're tired and you're fatigued, you make mistakes. So number one, the environment. Health workers are not safe in environments where you have 24-hour work cycles, where people are working too many days in a row, and where there are just such a concentration of patients that everybody loses concentration. When you lose concentration, you make mistakes. Secondly, those workers have to be properly trained. They have to know what to do. They have to be able to recognize the risk, and they have to be able to manage the risk. Thirdly, they need the right equipment, and they need the right equipment all the time, not just some of the time. And they need to be able to use that equipment and have access to that equipment to be able to protect themselves. So within that, there are individual things we do as health workers to protect ourselves. But most of the protection of health workers comes from the system. It comes from their employers and giving them the right training and the right equipment that they can protect themselves. Our health workers, our nurses, our doctors, our physiotherapists, our porters, everyone working in our hospital systems, our community health workers have been heroes to this world. They have saved countless lives. They deserve the best protection we can give them, including vaccination. And again, the reason why WHO continually calls for equity in vaccine distribution, there are still health workers on this planet who are not protected. There are still doctors and nurses going into COVID wards who are not vaccinated. And I ask you, is that fair? Is that fair? Is that acceptable to all of you out there that should be the case today? So the best way we can protect our health workers is to vaccinate them, frankly. And we haven't achieved that yet. And that is because of vaccine equity. Back to you, Maria and Alex.
Thank you, Mike. Maria, your message for health workers.
Yeah, I mean, absolutely. We have to vaccinate our health workers. And the question Mike asked is the poignant one. Is it right? Is it fair? And we all know the answer to that. The answer to that is no. But we need to take steps to remedy this. And it goes beyond words. I think those of you who are out there who are not health workers, you could advocate for this. You could demand this change from the leaders, our leaders, in doing so, in sharing the doses that we have. All the money in the world is not going to buy doses that don't exist. So we need to share the doses that we have, increase production. And there's a lot of good work happening in the space, but it needs to happen faster. I would also say that there are other ways we need to help health workers. We need the PPE to reach them, as Mike had pointed out, but we also need better PPE, personal protective equipment. We need masks that fit women. The majority of health workers are women, and masks and respirators and certain types of equipment are really designed for men. So let's get better designs. Many health workers around the world have to reuse single-use personal protective equipment still 17 months in, if they have the personal protective equipment. This is unacceptable. So we really need to make sure that they have the right supplies, as Mike has pointed out. But we need better supplies that can be reused, that can be disinfected safely. And that innovation around the use of PPE, we're seeing some of that. We need that progressed. We need that produced because I think that could help. And all of us can help. I mean, we can reduce the stigma associated with health workers, especially because many health workers have been infected with this virus. And there should be no stigma associated with the health workers who are doing their jobs, who are heroes in this tragic event that we are all in. So please, we've heard, we've seen health workers being attacked and abused, and that is also unacceptable. And all of us can do what our job, if we are not infected, if we do not develop disease, we will not need to seek that health care. And that bed can be used for somebody who needs it for COVID, but also for other diseases that are out there. Other people need the care that they need. So if we could reduce the burden on the health system by taking the steps to keep ourselves safe and our loved ones safe, this also helps health workers. So a lot that we can do, every single day. We need to choose to do it. We need to be able to do it and support it in that until this pandemic is over.
Thank you, Maria, and thank you, Mike, and thank you all health workers around the world for all that you've been doing for all of us around the world. And in particular, thank you, nurses, and happy International Nurses Day. I also thank you, everyone watching us from India, the US, Turkey, Iran, Italy, Belgium, Argentina, Mozambique, Switzerland, Tunisia, Colombia, Sweden, Jordan, Somalia, Brazil, and many other countries. Thank you for being with us. Thank you for...
Maria, Alex, can I interrupt? Because I think you've sparked something very important in me, because recognizing Nurses Day is really important. I just want to thank all the nurses out there who trained me, because there's a lot of doctors who think they were trained in medical school. Those of us who actually know what we're doing, we're actually trained by the nurses who showed us what to do and how to do it in busy emergency rooms and busy wards. So with thanks to those nurses out there in all the places I've been who've taught me anything I do know that's of value, thank you for all you've done for me and all you've done for doctors and patients. and other healthcare professionals around the world. You are the glue in the healthcare system. You keep it together. You make it work. So thank you all.
Thank you, Mike. Thank you, nurses. I have nothing to add to this beautiful message. Until next time, and stay safe, and follow our social media channels and website for all information on how to stay safe from COVID-19, but also any news regarding the variants, vaccines, and other knowledge and information that we are gaining every day. Thank you and goodbye.